So we need to get on that. Make sure any health care reform completely includes veterans as well. And we can do that in a single-payer system. That's where H.R. 676 is so important. It doesn't allow, H.R. 676, Congressman John Conyers' bill, which I'm supporting, single-payer universal Medicare for all. It will not allow anyone to be denied from pre-existing conditions. It will not allow deductibles or co-payments. It'll cover dental care. It'll cover medical care and eye and vision care. And this is what we need here, and we can afford it. And believe me, it'll cost us less per person. As a person who had elderly parents live in this great country and do so well, I would be 1,000% against any kind of government bureaucrat interfering with the right of your grandmother, ma'am, or your mother to live fully her God-given years. And I would put that in the legislation. Any legislation that I would support would have to have it written in there that people make their own private decisions in their intimacy of their own home with their parents and relatives. That's how it should be. You got my word on that. Here's a woman who had breast cancer, who was treated and then dropped, am I right, from your insurance company. And you can't find coverage again. And to me, this is actually, I want to use the word criminal. It's unethical and it's actually criminal in the real sense of the word. We cannot allow this to ever happen. And the reason it happens is because you have health care mainly for profit in this country. The private companies are mainly concerned about making profit. They're not mainly concerned about meeting the needs of people who need it and health care. So let me take you back to an ethical question. Are we our sisters and brothers' keepers to an extent? I believe we are. Every single religious and spiritual tradition and ethical tradition such as secular humanism has spoken that we are part of the same human family. We are our brothers and sisters' keepers. This is, to me, an ethical question first and foremost. Do you believe that health care is a fundamental human right that should be guaranteed to all in a civilized society? And frankly, it brings up a couple of questions. How do we pay for this? All of you are concerned about how would we pay for a universal single-payer system like H.R. 676. And frankly, right now, those of us who are insured are paying way more than we should. We're paying about close to $7,000 a year per person in the United States of America. In Canada and in France, with the two best systems in the world, per person it costs only $3,500. So it's about half the cost. And the reason for that is because the single-payer system is non-profit. It's like our Medicare here. And they cut the overhead costs, they cut the exorbitant profits and dividends paid out to stockholders who are making profits off the health care system.
I wouldn't be one that would change. I'm very happy with my medical coverage. I'm happy with my doctor. I can change doctors. I can change hospitals if I want to. I can do all kinds of things that I'm very satisfied with, and it basically doesn't cost me anything but a small copay. So to think that, yes, most people would change to a public option, I don't think that's necessarily the case. I think what would happen is that, number one, you'd open it up where the 47 million people that don't have coverage would then have it available. And two, if the costs were kept down as what the public option is really designed to do, that keeps the insurance companies in line.
That's right.
To have 50 million people uninsured, where do you think a pandemic or an epidemic is going to start anyway?
So important.
It's a petri dish.
Absolutely.
So,
yes, sir.
You know,
50 million Americans almost uninsured. And, you know, a pandemic could start with any of them and they could catch it and spread to the rest of us who are insured. So we need to get on with this, folks, and start having public health, preventive care. We've got to work on educating our young people to eat more healthily. In fact, young people are growing community gardens now outside their schools and learning about organic farming. I think that's wonderful. We should promote that. We should have public funds go into that kind of a program, and that way we can get people to be more healthy.
When you get to Congress, will you...
Did you hear she said, when I get to Congress? I like that. Thank you, Helen. When we get to Congress. I'm taking you with me. I'm taking all of you with me. Yes.
I'm free. I'll go.
All right.
I'll back you up. Anyway, I retired from the VA hospital in '97. I saw through when the Vietnam soldiers came back. Many go through the cracks. Yeah. We had stand down in the Veterans Administration maybe once a year. Thousands would come. But it was only once a year. We were all volunteers. Would you be able to do something like that, not only just for the soldiers that are going to be coming back from Iraq pretty soon, because they're all messed up,
yes,
physically, emotionally. And if you could do something for that, And for the people I see on the street all the time, I walk, I don't drive, I don't have a car. And so I see a lot of people that just a simple care could help if you could put that in somewhere.
Absolutely, 100%. Let's hear the hands for that, please. Give a hand for that suggestion. Matter of fact, Helen, we want to thank you for your service with the VA, and I was at several stand-downs that were held in Veterans Stadium.
Were you?
And took part in those. You probably saw me there, and maybe you recognized me. I didn't have my gray hair then at that time. But honestly, that's really wonderful what you're saying, and it's absolutely necessary, especially for our veterans and our homeless people and our homeless veterans, which increasingly there are more and more of them, aren't there? We see them on the street. This is outrageous. It's homeless veterans. That's what stand-downs are for. I attended one in Compton in our district just last summer. So to answer your question in short, we can do this. Other countries have done it. We used to have this. Tuition-free education and universal health care free of individual charge, so folks like that lady over there can be brought back in the system and treated. That's a human right. It's a God-given right, ladies and gentlemen. It is not a privilege, because every one of us is vulnerable. Every one of us is human. We have to act to get that universal single-payer system, which will become a legitimate chain that promotes freedom, freedom of being able to live well. And this is tied back to not just the Constitution, but the Declaration of Independence, right? We hold these truths to be self-evident, that all men are created equal, meaning all humans are created equal, each one endowed by the Creator with the rights, inalienable, unalienable rights, the rights to life, liberty, and the pursuit of happiness. Now you tell me, folks, how can we pursue happiness or life without good health care and adequate health care for us? We can't. That's why I would say the right to health care, the seeds of it are right there in that Declaration of Independence, the unalienable rights. It is one of those unalienable rights, parts of it.
The bandy about the number of $1 trillion is what it would cost for the reforms that are proposed right now. And the only thing that I think we should question is nobody raised the cost when we were conned into going to war in Iraq. Yes. Nobody raises cost of a $300 million airplane that doesn't have anything to fight against.
That's right.
So we can do these kinds of things with our money. I would think that why would anybody not want to vote for universal health care?
Great point. The cost of the Iraq war, which I did not support, I advised President Bush to not go into Iraq, to let the inspections work. I did that on NBC doing midday news program where I was a commentator, and of course we know what happened. We went into war in Iraq. It was a war of choice, not of necessity. Iraq had nothing to do with 9/11. And in the end, we ended up spending, according to economist Joseph Stiglitz. Dr. Stiglitz is a Nobel Prize winner. Stiglitz calls it the $3 trillion war, ladies and gentlemen, because the cost of the war so far in Iraq has been about $700 or $800 billion. But you have to look at the cost of more than just the weapons and the cost of paying our troops there to fight there, but the cost of when our troops come home and are injured, or if they've been killed and they can't go to work to produce more in this country and to be good fathers and mothers because they're dead. And the other thing is the cost of mental health care, which many troops are coming back with a lot of post-traumatic stress disorder and syndrome. And they need some real help with mental health care, and President Bush actually cut the mental health care coverage, didn't expand it to where it was needed. These are the costs, the hidden costs, and not to mention the interest rate, Jerry Lee, the interest rate on that cost. A $1 trillion war turns into a $2 trillion war when you add the interest rate, because President Bush borrowed the money to go to war in Iraq. Every bit, every one of those dollars was borrowed, which was outrageous in my view.
Could possibly, since you mentioned September 11, is there some way we could get that enthusiasm of the people to move on this issue?
That would be a great symbolic date. Yes, it will.
I was asking, how do you do that?
That can be a commemoration of September 11th and bringing something beautiful out of that horrible tragedy, saying that we need to end that war rapidly and responsibly, bring that money back for health care reform. Let's get to Congress and really spread the word throughout the country and get President Obama some support to become more progressive and push in the progressive direction. Thank you so much, and God bless you. I'll be here for you. Peter Mathews.